that we are in the county doing many things and some similar things. Similar things in same sub-counties, and some sub-counties are not benefiting from the same services. You realize that in your introduction, I counted about 4 partners who are doing policy. You know, when you're doing policy, it ends up into like public participation and all that. If we put those resources together, how many we could achieve more by leveraging on our resource envelope. Then you also look at you find that we have several of you doing primary health care. Where are you doing this? When you landed at the county, did you know that there was somebody that's at county? So we just want to see muko kwa Kabuchai, muko Mount Elgon, muko Bungoma. Then when we break into discussion groups, the similar groups shall sit together. Hapo sasa ndio mtakuwa mnajuana, because when you land at the county, when you are doing activities, umekutana na wananchi on the ground. Kidogo wananchi wanasema there's another group that was also here. We want to harmonize and synergize those resources. It will have a more impactful output by distributing these resources and serving all our county members well. I think that is a major aspect. Again, we are asking when you are doing your plans, we align to our CIP, the 5-year integrated plan for the county, and the ADP, and the development plan, so that when we are answering questions at the assembly, we are actually following PFM rules and regulations. So I know Waziri has a lot to speak to us into this today symposium, and I am very excited and very delighted that all of you are on board here. Yesterday when we were at Eldoret WHO meeting, I was with the governor, he was a panelist. We also spoke into research. That's how Cambridge are in the house. And we said, how can we do, and that's what AMPAC does, a research-oriented decision making. So that when we are making decisions, they are informed by the demands that you have researched. It has ideas, it also will avoid the duplication that I'm talking about. Like the Misha are doing something on HR, they are looking at numbers, facilities. That will come out and inform us. You have more staff in this facility, you have less staff in this facility. That information will help us move those staff into the needy facilities. That is the essence, basically, of why we are seated here. For those few remarks, let me invite our Waziri. I don't know whether you want to do it from there or you come here to speak to our symposium and give more information on why you're here.
Good morning, everyone.
Good morning.
My name is CPA Crispinus Baraza, the CEC for Health and Sanitation, Bungoma County.
I did say my name. My name is David Malina. I say that.
Thank you. So, karibuni sana. Wageni wetu, all of you are welcome for this very great day for Bungoma. First, I want to say that we have really planned for this day. This we have actually postponed 3 times, but we say this one we are not going to postpone. It must happen, and the reason why it must happen is because we don't have time. And health is an environment where we are talking about life. So if we keep on postponing, then we might also be losing life. So the key areas which I really want us to understand why we are here is because we set the objectives, why we are here, so that at the end of this session, or 2 days, we must answer those questions. And one of them is actually why we are all here, that we want to map all the partners. Actually, I knew half of you. There are those that we have never even met, but we have met today. But they have been here more than 3 years. And half of them we have never met literally, face to face. There are those we have never met, but we are partners. Is that fair? You are a partner. You know when you say partner is spouses. You can imagine you are called partners, but you have never seen each other. But you are in a relationship. And we have also been told there are those who are working with us, but we have no engagement document. But they are with us. So those are the things that we are saying. First step is to know that you exist in Bungoma. That's the first step. And that's what we are saying. We must register, all of you, that you exist in Bungoma, because we must know it, that you exist. So that's the mapping we had to do. And we have told our secretariat, we must register you and also give you a code. Because you are our partner, and we must recognize you. Whatever contribution you are giving to Bungoma, it must be visible. It must be visible. So that's the first thing we want to achieve. And that's why I want to thank all of you for being present today. Because this day, day one, is the most critical day. After knowing who you are, you must also know, and I'm happy, Chief, you have mentioned, that we are having activities you are carrying as a partner. You came with an objective also, as a partner, to contribute towards Bungoma. But you have also heard among yourself that the activities you are carrying out, another partner is also carrying out. You have heard for yourself. But you have also confirmed that the person who is doing what you are doing, you have never met. And you even don't know what the other person is doing. But as a partner, you can't come into Bungoma. So what are we saying? Are we losing resources? Are we misapplying resources? Are we in conflict? Are we overlapping issues? What are we doing? It tells us that we are not organized. It tells us that we are just want to be there and hear that we are there. So this objective of harmonizing these activities is that if you are saying you are dealing with the policy, that is it. So how many have we done? And how many have we achieved? And if you are partners, what were you doing in that policy-driven environment? And what is the other one doing? That's why you must sit together, because we are partners. And we operate on a straight line. We must operate on a straight line. As Bungoma County, we must set the standards of engagement. Because the resources we have, we might misapply them. So one of them is we must harmonize all of them. And when the program acceleration, we need to do the acceleration plan. Who doesn't know about it? It is an emerging issue. How many partners are dealing with mother and child care? How many? mentioned here. There are many, isn't it?
Yes.
But you don't know each other. You don't know even who is where. Where are CHPs? You can stand up to see. Thank you very much. Thank you very much. You can sit down. These are our grassroots soldiers. But you know what? Nowadays they don't work. They are very happy, by the way. Reason? You engage them full time. Full time. In fact, in a day, they can have even 3 partners engaging them. Yes. In the morning, in the afternoon, and even at night. So, 7 days in a week, or 5 days in a week, when will they discharge their duties at the grassroots? When will they visit the household? When? Because that question must be answered. Everybody, you want to engage them, fine. But when will they be on the ground? That's a question that must be answered. And that's why we are saying we must dictate the standards. If we are saying, CHBs, we have our partners, we allow you Monday, Tuesday, you must engage with our partners. Those are the days we have identified that partners we want to engage with the CHPs, Monday and Tuesday, you are free, you can engage them. But Wednesday, Thursday, Friday, and whichever, they are on the ground doing their job. That's being ordered. That's being ordered. CHPs and my office and myself were the same. If I wake up in the morning, I'm called to attend 5 meetings. 5 in one day. But our partners who want to see me, there will be more than 5 in the same day. So the whole week, I'm supposed to be in meetings. When will I be on the ground? Those are serious questions we must answer. I must be on the ground, but I should also attend to you. And that's the reason why we say we must have a committee to coordinate the activities of partners. Because we must be ordered. We have that committee. We just stand up. This is Partners Committee in the county, headed by our deputy director. You can raise your hand so that they see. So if any partner if any partner wants to come to the county, they must first of all interact with this team. You present your case, discuss, agree, and set the standard. Then they say, yes, this one is okay. Now, see on Monday, you must you have a meeting with your partner. We have discussed, this is the issue. When to me in advance, I also go through, I understand what we are going to discuss on that day. I'm telling you, I will have a mental issue. And I've had partners here, there are those who are dealing with mental. I also need to be checked. I also need to be checked because it is a serious issue. It's a serious issue. Unless they also plan for me, and also I become organized so that I say, this week, this is the number of meetings I'm going to have, and this is what I'm going to plan for myself in the office. That makes my mind also understand what's supposed to be done. Otherwise, I'm going to be your customer as a partner. So that forms the basic reason why we are here. That space we are struggling with. And I told one of the partners, Mwambia, there is a mother in a certain location. He was called by around 3 partners over the same subject. So that mother was not understanding why the same subject 3 partners are calling. You get it? It just tells us as a county, we are not controlling our activities on the ground. 2, and I'm happy, Lifecare team, you are here. I'm very happy. Private hospitals, faith-based hospitals, are all our partners. They all patronize share. The patient they are treating in the private also faith-based, they also come to the public hospitals. You get the point? So there is this mother who comes from this village, CHP. You know there is no CHP for faith-based, for private and public. It's true. So where will this CHP take this man for antenatal clinic or something? Where will he or she take? What? Which hospital? Public, private, or faith-based? It is the choice of the patient, isn't it? But it is also influence process. True, false? It's an influenced process. So CHP are on the crossroad. And we are on the crossroad. Whoever stands on the way and points properly to the direction they're supposed to go, they will go. Does that matter to the health of that patient? Where that patient is going? Are we competing? We're not competing. I asked someone, there is an ambulance in Bungoma, but it belongs to a private hospital, but we need it, isn't it? It is needed, but there is no collaboration on how we should get it. It has never happened. So we are supposed to count how many ambulances we have in, for example, Kandui sub-county. It belongs to a patient care. So there must be existing partnership. How do we access these common user items? Blood. We have a satellite office. How do we get it? Or we assume that the blood will find itself into the blood bank. How do we reach there? Those are the questions of partnership. That is the reason why all partners must understand what do we want to achieve, and we are all on a straight line. Don't hold someone's hand on that straight line. Hold your space. Don't overlap. Don't compete. Don't create conflict. Just know what do you want to achieve for this mother, for this child, for this patient. That is what matters. And that's the reason why we're here. We want to strengthen our relationship. And we can only strengthen our relationship if we know what each one of us is doing and which space we are patronizing. And once we have done that, we must, after this today, we must have a partnership framework. We must know the rule of the game. We must know if you are offside, someone must raise a hand that you're offside. My staff hapa, I don't know kama ako mwenye na deal na referral kesi. You kama ako. Simon, are you around? Yes. How many times have you been stuck to take a specialist to a hospital? Many times. Many times. So it's a risk. Are you getting? You know, you are saying before the partners that you cannot take a specialist to a hospital where he is needed, and that's a gap. Thank you. referral. Daktari, wewe unataka specialist wako referral because na mgonjwa wako kwa kitanda. Which decision are we supposed to make? Would the specialist to come or the patient to come? Yes, that is the ideal situation. But if we don't know each other, what happens? Life care, deal with your issues in life care. Bungoma, deal with your issues. That is what matters. Is that what we want? That is not what we want. So we must, as partners, sit down, agree on the rule of the game. That's the reason why we're here. Tukitoka hapa, niongee Kiswahili. Tuwe tumekubaliana jinsi natakana tufanye kazi pamoja. There is no winner anyway. There is no loser anyway. We are just one team. At the end of this, today, we want to have a resolution on all the parameters that will have the weakness in the system. This secretariat that we are seeing here is actually working on gaps that exist. They will also present at the end of the day. So that as partners, we must agree, have we completed all the challenges in Bungoma? Then how are we going to move forward from now? So that tomorrow, we are going now to make a decision before the governor that this is who we are. Not who they are, who we are. Tomorrow. Then we are going to have a medical camp in September. Major. And in that camp, there are several activities that will happen from day 1 to day 5. And there's a day purely for partners to showcase the issues. The public, the county, the governor himself, and the president. That's going to happen. Go. So, I want to wish you well. I'm going to be around. I'm going nowhere. I'm going to be crisscrossing after this into groups to see what is happening. When you quarrel in a table, please call me. I'm going to harmonize that. When you don't agree, I'm there. We want to harmonize that. Because the stage we are going to move in now is grouping the partners and our team so that you agree on how we need to partner in that process. After we have done that, each group now will come and do a presentation so that we understand all of us are we on the right track. Then we agree on the way forward. So that tomorrow, when the governor is there, we communicate what we have agreed. Tunaelewa hiyo? Are we now together? Are we together? Yes. Kuna mtu ana swali kwa sababu nimemaliza. Ukiwa na swali ngumu niulize kwa sababu tukitoka hapa sasa tunaambiwa vile tunajigawa. Napenda swali ngumu. Kuna mtu ana swali? Uliza tu, hata kama nimesema vibaya unasema hapo uliteleza. Na kama pia hakuna mtu mwenye swali wameelewa kenye nimesema.
Am I seeing a hand somewhere?
Comment hapa.
Or a comment? It's a free, very free meeting. Clarification?
Najua nimetumia hard words sasa kuenda pia kutafuta Tafuta swali inakuwa ngumu. Inakuwa ngumu kidogo.
Na appreciation.
Unajua nimekuwa nikifunza, so hiyo ndio shida.
Okay.
Ni swali ama
Amesema appreciation. Okay, see our CC. Thank you very much for that very wonderful direction that you have provided the team, because even for me, where I sit now, you have just spoken my mind, because we do so much, but it's disintegrated. So purpose of this meeting, as you have highlighted, if we are going to integrate what we do so that everybody is making a contribution towards the success of our health in Bungoma County, then I know that even the things we struggle with, like maybe HIV, GBV, teenage pregnancies in the health department, will in a very short time, we will be able even to showcase to the entire nation what we have done and the success that we have achieved within a very short time. So I'm Fred Baraza, County Multi-Sector Coordinator, National Syndemic Disease Control Council. Thank you very much, Waziri.
Any other remark? No. Question?
Simon, they are ready for good discussion. They raised value for good discussion.
So, Director, I think you will now confirm the arrangement, because we need to go to the groups straight away, so that how they are going to arrange. I think the best, which I want to know, is arrange them by the thematic areas, so that it becomes easier to handle those areas. Is that okay? Who is taking up?
Yes, thank you, Waziri.
Thank you.
We'll allow Simon to present the templates that we have, just to guide on what we want to discuss even as we go to groups, and also categorize us as per the groups that we'll be sitting. Thank you. Karibu, Simon.